Welcome back to Medicine Chopped. My name is Mosia Wanjiru, and today, as I stated in the previous video, we are going to be talking about mug meals. That's what I'm going to be cooking today, and we are going to do the breakfast, lunch and dessert. So the lunch can be dinner also, and we are going to be talking about immunization as well baby clinics. Thank you. Let's get to it. So the immunization schedule that I'm using, that is KEPI schedule, and the KEPI schedule states that once at birth the child should receive BCG and oral polio. That is before 2 weeks after birth. BCG is usually used to prevent tuberculosis, and that's because in Kenya we are at a higher chance of or higher risk of contracting TB. As for oral polio, I know most people thought that it was cancelled out, but no, it's still there, and it's given at birth and also at other weeks, which I'll state in the next few moments. The oral polio is supposed to prevent polio, which was a deadly disease before the vaccine was given, and oral polio is given through the mouth. BCG is given on the arm, that is near the elbow. The doctor knows the place that's supposed to be given, and I think most people have the mark that is there. That one's mine for my BCG. The next one is supposed to be at 6 weeks, and for that you are given oral polio, the second dose. Then you're given another one called pentavalent, another one called pneumococcal vaccine, and the other one is called rotavirus.
September we met, I could tell by your smile. You hadn't been with a good girl like me in a while. Yeah, you were impressed, couldn't leave me alone. Text me every time that you pick up the phone.
And here we have our oat with peanut butter and jelly mug meal for breakfast. Ooh, can't wait to taste it. And I'm using apricot jam. You can use any type of jam you want. I mostly like apricot jam. Valent vaccine contains 5 vaccines inside it. The first one being diphtheria, which prevents throat infections, some types. The second one is the pertussis, which prevents whooping cough. The third one is the one which prevents tetanus. The fourth one, it prevents hepatitis B. And the fifth one, it prevents Haemophilus influenza. That's a type of virus that causes flu. I'm using a microwavable bowl because my mugs are not big enough to allow the water to boil. So if you do not have a mug, you can use a bowl as well. Now we're going to take it to the microwave. Remember to drain the excess water after your macaroni is done. Weeks is 1 month and 2 weeks. 10 weeks is 2 months and 2 weeks, and for 14 weeks it's 3 months and 2 weeks. At 14 weeks, there is an additional injection that is given, that is inactivated polio vaccine. That is apart from the oral, it's now injectable, which was introduced in 2016. So that one is also given the same time as the pentavalent pneumococcal vaccine at 14 weeks. After 14 weeks vaccination, the child is taken for each and every month for weight check, and that's usually used for growth monitoring and development. The next vaccine is given at 6 months, and that's the vitamin A, which is usually blue in color, and also weight is also taken at 6 months. The next one is at 9 months, and at 9 months the child is given the measles vaccine, the first one, and has also had their weight taken, also for growth and development monitoring. And also in some parts of the country, like in the northeastern part, children are given the yellow fever vaccine, or if you are traveling outside the country, you're also given the yellow fever vaccine. At 1 year, the child is given vitamin A also, but this one is a different color, and this is red because of different dosages. That's why they have different colors, and is also taken for the weight, and also given deworming. That's albendazole, which is usually given. Then after that, there'll be weight checks in between until the child gets to 1 year and a half, and that's where they're given the second dose of measles. The measles vaccine also contains the rubella vaccine, and that's the one that prevents mumps in children. Then also they are given vitamin A also. Now from there on, from 1 year heading on, it's usually the red color only that is given. Weight check is done every month, and also deworming is done after every 6 months. During this pandemic that we are currently having of COVID-19, it's important for women and mothers to take your children for your well baby clinics, and that's because these vaccinations are preventing diseases that cause epidemics themselves. So just because you're washing your hand each and every other minute doesn't mean that you're preventing your child from getting these infections. So please, even if it's for the weight that you're supposed to take the child for, please take the child to your clinic, because as I said, weight is used to monitor the growth and the development of the child, and the doctor will see that when they're doing that. Even you as a mother, you notice things with your children, like your child is not feeding well, your child is not playing as much as other children the same age are playing. So when you take the child to the doctor, you tell them that they will help you out. But if you keep your child at home because you're trying not to go to the hospital, trying to avoid COVID, it's not going to help you. The side effects of vaccinations, it's usually mostly fevers because of the introduction of something new or a foreign thing in the body, and also pain on the injection site. The child will have these side effects within the 24 hours, but as a mother, you're supposed to monitor. If the child cries more than 3 hours continually, please call your doctor or visit the hospital again and tell them that. The site of the injection will swell up. Sometimes it will, sometimes it won't, but that's a reaction that usually happens. You just monitor it. Do not try rubbing the site of the injection. Do not try anything that you've been told by other people to do with it. What you're supposed to know is that you give the child paracetamol, which is usually good for the fever and for the pain, but do not give in a duration of 6 hours. You give more than once. Then something else, you can expose your child when they have a fever, and use sponging, that is warm water. You dump them with the sponge, leave them for 10 minutes exposed, then the temperature will drop. Also, you can continue breastfeeding your child or feeding if they're not breastfeeding, which will put their mind off the injection that was given. Another thing with the swelling, you can use a damp cloth that is wet and a bit cold to put on top of the injection site, which usually helps it. And I'll say this again, do not rub the injection site. Most medical centers right now in the pandemic, they have put measures to stop the spread of COVID-19. So even you as a person, just continue doing social distancing when you're in the hospital. Wash your hands, sanitize, and wear a mask on. But for children less than 2 years, the mask is not advisable because it can create some breathing problems. So you yourself as the mother or as a parent, you're the one who's supposed to have the mask on. And when you get to the clinic, you can ask your doctor as much questions as you want to regarding your child, regarding the prevention of COVID. Thank you for watching this video. Please subscribe, like, comment. Let's talk about these things. I'm there to answer you. You can go to my DM if you have a personal question. That's on Instagram. And today we made mug meals, and we did peanut butter and jelly, oats. We did mug brownie. That was our dessert. And for our lunch, we did macaroni and cheese, which can also double as our dinner. In case you feel like there's something we would have done different for this video, please put it in the comment. Next time, we are going to be talking about ulcers, and we are going to be making a dessert, but in a different method than the mug one. Thank you. Have a good time. Bye-bye.